Welcome to another edition of The Scoop. Today we're going to be bringing you some news you can use about hospice, and we're talking today to Cheryl Hamilton, who is the director of the LifePath Hospice in Hillsborough County. Welcome, Cheryl. Glad you could be here today.
Thank you for having me.
Let's get into this. First of all, I don't know if everybody knows the history of the hospice movement. It's really not that old, considering how long it's been since we got medicalized in the process of death. But about how old is the movement, and then tell me its history.
Well, in the United States, the first hospice started in the early 70s in the United States, and the first hospice was in Connecticut. It was an inpatient facility, and actually Florida is credited with having the third hospice in the nation. LifePath Hospice started in 1983, but prior to about 1986, all hospice care was provided as charity care. There was no reimbursement for services. Florida was the first state to have a licensure law for hospice, and shortly after, Medicare, the federal government, created the Medicare hospice benefit, and that was in 1986. And so since 1986, hospice care is an entitlement for all seniors.
Which is good news for seniors.
Absolutely.
And so there is no cost for the care, and the care involves.
That's correct. It's actually, I think, one of the most underutilized Medicare benefit for seniors. It is 100% covered by Medicare, so there are no co-pays or out-of-pocket expenses. And once an individual is admitted to the program, then services can continue throughout the duration of their life.
Talk about what services, what they are exactly, and who is entitled to access it? What is the criteria for accessing the services?
Well, in the state of Florida, we're actually very privileged to have a Medicaid benefit in addition to the Medicare benefits. So in the state of Florida, the criteria is that somebody has to be deemed terminal with 12 months to live, or 12-month prognosis, by their attending physician if they have one. And then our physician within hospice has to agree to that prognosis. The Medicare benefit, the federal benefit for hospice care, is at 6 months or less, and so the certification for terminal illness has to be at 6 months. But we know that prognostication is not an exact science, and so we do have many individuals that live beyond 6-month period of time, as long as the physician can continue to certify that if the disease takes its normal course, then life expectancy would be within that time frame.
I remember I was involved with the hospice in Hillsborough County for a number of years, and wrote a brochure for their original capital campaign. And I interviewed a young man who was certified as, he had a very congenital heart disease. He was lucky to be alive 19 years already. He had lived 2.5 years already when I wrote about it. Wow. And he actually attributed to the friendships and the volunteers and the caring that he felt at hospice, that he should not have lived that long under any circumstances. And does this commonly happen, that people will live longer than perhaps, the time that they're given?
Well, it may not be too common, but I will tell you that individuals that have appropriate medical attention certainly have a better opportunity to have a longer life. And there actually have been recent studies that are kind of contrary to, I think, what people have traditionally thought about hospice. And I used to actually talk to many people that thought hospice care was sort of to help hurry them along, unfortunately, and I think that's a misperception.
There's a lot of myths about hospice, and I think we should break a few of those.
Absolutely.
But so, you found that out?
Yeah, so what, recently there have been many studies that look at patients that have been enrolled in a hospice Medicare benefit versus traditional Medicare. and they've actually found that patients do live slightly longer. It certainly isn't a cure for something that will inevitably be in the normal course of the disease.
My mom went through hospice, as I mentioned earlier, and I didn't take her through the biopsy that would have proven whether or not she had pancreatic cancer, which I'm pretty sure she had, because that was enough already. But she was definitely not thriving, and she seemed to be able to enter the program. So that seemed different to me than the way it used to be. Is that right?
Well, I think hospice has evolved over the years in many ways. Early on, most hospice recipients had a cancer diagnosis.
Right.
Used to be that about 80% of hospice recipients had cancer and only 20% had a different diagnosis.
Okay.
Now we're actually seeing that change, whereas around 60% in our area, and this follows true nationwide, that have a non-cancer diagnosis, and only approximately 40% of the patients that are being served have cancer. So I think hospice is being used more than it was, even as much as 10, 12 years ago, only 20% of the deaths in the nation were served with a hospice provider, or served by a hospice provider. And now, nationwide, it's approximately 40% of deaths are cared for under hospice. And in our community in Hillsborough County, we care for approximately 63% of all of the deaths that occur. We have the privilege of being there and providing service.
Of those 60% that are not cancer, what are they? Heart disease, or AIDS, or or it's just
Could be
nothing prevalent?
Could be many different diagnoses. We see the majority of those patients that are being cared for that are not cancer would fall into a lung disease category, COPD, chronic obstructive pulmonary disease, heart disease. It could be patients with Alzheimer's, dementia, many other diagnoses.
Let's find out more about that in just a minute. We'll be right back.
News you can use.
Welcome back to The Scoop. I'm Louise Thompson from Tampa Bay Community Network, and with me today is Cheryl Hamilton from LifePath Hospice, and we're talking about the services provided by LifePath and other organizations, I suppose, in the state. How far out does LifePath Hospice go now? I mean, you're covering more than Hillsborough County, correct?
Well, as LifePath Hospice, we are covering Hillsborough County, and we also, there is a program that is affiliated with us that is called Good Shepherd Hospice, and they cover Polk, Highlands, and Hardy counties.
And then there are other hospices in the rest of the Florida area, right? In the territory of Florida, there must be hundreds of them, or dozens at least anyway.
Yeah, there are quite a few, and if individuals want to, and I would encourage anybody in other areas to contact the Florida Hospice and Palliative Care Organization.
And we're going to run a slate with that on it at the end of the
Great.
show, so at some point, so people can see where to find that on their telephone number and website.
Okay. And they can put you in touch with a hospice that is serving in your community.
When you're trying to access the services, do people call their hospice directly, or do they talk to their doctor about it? Does the doctor make the recommendation? How does that work?
Any number of ways. We really try to make accessing hospice care as easy as possible. Certainly, folks can call our organization to ask questions just about services, about what we offer, if it may be right for them to access. I would also encourage individuals that have questions to talk with their physicians. If they're located in a nursing facility or assisted living facility, family members can talk to administration in those areas. So we take referrals from any entity or any individual.
So it could be a family member, or the doctor, or so forth.
Absolutely.
Besides the actual care, which is given by nurses and social workers and volunteers to the patient.
Well, each one of our interdisciplinary groups is led by a physician that is employed by our agency, either on a full-time basis or on a contract basis. We have a medical director that oversees all of our medical services within the organization. But the physician really leads the interdisciplinary group, and those individuals consist of a nurse, a counselor, a social worker, chaplain, volunteer support, and our hospice aides who perform personal care and some homemaking services.
The volunteers are available to the patients, but also to the families, right?
Absolutely, and I'm glad you brought that up because we always need volunteers, and so I would encourage anybody watching today if they have an interest in participating with the organization. And we have volunteers that work in our offices. We have volunteers that work directly with our patients. So there's so many different ways that you can volunteer and help support
I
our
remember
organization.
one of your patients telling me his volunteer took him fishing. Is that right? Is that something? Or played maybe checkers with him, or these kinds of things, right?
There are so many things that our volunteers do, and they really add a component to of care to our patients and families that really is unique and really maybe oftentimes can't be met by our employed staff. They have the time to come and play checkers or read.
So if people really want to feel needed, this is a good way to do it.
This is a great way to do it. And again,
regarded very well. I know
Absolutely.
they are regarded well.
Absolutely.
What about the other services like bereavement and helping children with their grief? I know that's another important factor. Do you go into the schools sometimes, or you read about some tragic event at a school and?
We certainly help in the community in any way that we can. One of the areas that we are able to help with our children is that we do have the Children's Grief Center in the Hillsborough County area, and in the Polk Highlands and Hardy area we have what we call the Bethany Center. Both centers care for children who are grieving a loss of a family member or friend. Oftentimes we do get referrals through the school system. And the loss may not be somebody that has been cared for by our program, so it doesn't necessarily has to be somebody, the family member didn't have to have hospice services. It could have been a very unexpected passing. And the center brings children in to help them with their grieving process, and it's based off of the Dougie model, which allows children to grieve through play and with other children in an area that they're comfortable and can express their grief and safely.
What about children that have terminal disease, which must be the most awful thing in the universe?
Absolutely. We do have a number of children that are actually receiving hospice services through our program. It is very challenging, and we certainly do not advocate giving up hope for those children, but we certainly are able to provide the much needed care in their home that they may not be able to get through any other organization.
And so they access the full range of services as well.
Absolutely. We care for people from 0 to 100.
I think people don't realize when you pick up the paper and you see, well, this, somebody died in a car crash, that could be 5 children affected by this, or a great number, nieces and nephews and their own children and so forth. So it's really a very big deal.
Absolutely, and that is why we created the Center for Grieving Children. And prior to that, and over about 16 years ago, we started the Circle of Love grief camps that we do. And those are annual camps, and we have about 100 children a year participate in those camps, and again, along the same lines, it helps them grieve with other children, and many times makes them not feel so isolated.
So they actually go off to camp?
Absolutely.
With other kids that are having terminal illness? Actually,
our camp is for children who have also experienced a loss.
Oh, besides the fact that they also may be dying as well, or no?
No, not in those particular
situations.
situations. Yeah, those are for children that have experienced a loss, and it gives them an opportunity to grieve with other children and allow them to, again, not feel so isolated and alone. Many children feel like they're the only people that are experiencing this because other children at school don't have those similar. We have found that allowing them through the expression of play to express their emotions, it really is helpful for them to grieve in that way.
So, I do want to talk, I do want you to give us some advice on how we handle when people around us have experienced loss, especially children, and we'll be back in just a minute to talk about that. Louise Thompson from Tampa Bay Community Network. Cheryl, I think viewers might want to know that it's not just people being treated at home. There are people who can't be treated at home. As I mentioned to you with my mom, we got to a certain place where I no longer could handle her by myself. So you have places that they can go and receive treatment or services from hospice, right?
Absolutely. We try to meet whatever the patient or family's goals of care are. And so if that is to be at home, there are many things that we can do to assist individuals in staying in their homes. If that cannot be the case, then we do have other locations in Hillsborough County, as well as in our Polk Highlands and Hardy area, for individuals to go when they cannot be treated at home. If they have a particular symptom that is out of control, or the care becomes very, very difficult for them, we're able to provide that support. In Hillsborough County, we have a 24-bed inpatient facility in the Sun City area. We also have a 24-bed inpatient facility in the Temple Terrace area, and it's truly an alternative to hospitalization. We also have an 8-bed residential facility in the Sun City area that can support individuals that do not have caregivers or are unable to receive care in a nursing home or an assisted living facility environment.
You also have facilities inside cancer hospitals any longer, or no? I know you did with Moffitt for some period of time anyway.
Yeah, we did, and at this point we do not have any inpatient facilities that are located in hospital settings. Our inpatient facilities are freestanding facilities that we run and operate.
So they're not
and
inside
staff.
nursing homes or hospitals anymore?
No, not in this particular county, but hospices in other areas do sometimes choose to operate inpatient facilities in a nursing home or in a hospital setting.
Okay. I think there's a lot of confusion with regard to treatment. Can you talk about that? What kind of treatment that people can expect to get or their loved ones to get?
And we talked about some myths of hospice care earlier, and I think that is also a myth that individuals that access their hospice care have to give up something. I think people feel that way. And for early years ago, and still I think today, there are some hospices that do not admit patients that are receiving chemotherapy or radiation or IV therapy. And so every hospice is a little different. And so again, I would encourage individuals to contact hospices in their area to determine what the eligibility criteria is and their admission criteria. At LifePath Hospice and at Good Shepherd Hospice, we believe that patients should, if they have a appropriate prognosis, should be able to come and onto our program and access their hospice care without having to give up treatments that would be palliative in nature. And palliative basically means any treatment or care that would relieve the suffering, whether it be mental, physical, spiritual, or emotional suffering. And if the treatment is considered palliative in nature and not
for example,
life-prolonging.
sometimes like radiation may be considered
Absolutely.
palliative because a tumor is getting too large to manage or something like that?
Yeah, we would typically see somebody, for example, with radiation that might be the cancer may have spread to their spine, and maybe they're having that site radiated, which would prevent them from becoming paralyzed in some situations. And so certainly that would be palliative in nature. So, but there are many treatments out there that we will accept patients and continue their treatment and therapy. And again, I think people often think that they have to give something up.
Or I'm going to end this sooner by going into hospice, and that's really not so. And then what about, I think that's a myth, and then also the one, just addressing how everyone gets to choose what they want to do.
That's
What,
correct.
do you want to hit on that for a minute?
Absolutely. I call it sort of being able to write your own script and at the end of life. Really the true leader of our team is really the patient and their family. Those individuals will lead and choose the types of services that they do want or don't want at the end of life. And we're here to help them with that, to provide them with as much information as we can and to walk with them in that journey. So there are people that, as we talked about, that want to stay at home, that maybe want to go into a hospice house. They don't want the burden to be on their family. So there are so many different scenarios, and everybody is unique in that. And so truly, we want to honor that.
And they get to choose whether they're going to accept a do not resuscitate at a particular time, or the withholding of liquids. And I mean, I think you have to almost say that out loud.
Yeah.
So if they want to have nourishment, they are entitled to have nourishment. And if they say, no, I don't, you're not going to force it on
Absolutely. And we really encourage people. Now, it's not a criteria for somebody to come onto our program, but we encourage individuals to think about, if they have not already, their advance directives and what is it that they do or they don't want at the end of life. And I think we often think about what we don't want versus what we do want. And so I really encourage people to think about both of those. We have access, if individuals, and I know that you're going to flash our number on the screen, but any more information that individuals would like just about advance directives, we would certainly be able to direct them and provide them with information about how to have a living will. I cannot stress enough the importance of that, and to be giving thought to not just nutrition at the end of life or food and fluids, but other treatments, dialysis, IV therapy, antibiotic therapy. There are many other treatments out there that people should talk about.
Do you cover some of that now on your website?
We do, and that would be an excellent place to
and your website is?
It is www.lifepath-hospice.org.
LifePath-hospice.org.
That's
Thanks so
correct.
much for joining us and filling us in on that.
Thank you.
We'll
for
see you
having me.
next time.
Thank you for having me.
News you can use. News you can